Welcome to my channel. 1. The process of chemical digestion for carbohydrates starts in the A. Esophagus, B. Stomach, C. Duodenum, D. Oral cavity. The answer is D. Oral cavity. 2. Which organ listed below contains 3 layers of smooth muscle in its muscularis externa? A. Small intestine, B. Esophagus, C. Stomach, D. Large intestine. The answer is C. Stomach. 3. The majority of nutrient absorption in the digestive tract takes place in the A. Ascending colon, B. Stomach, C. Jejunum, D. Ileum. The answer is C. Jejunum. 4. The small intestine features permanent folds that run along its length, referred to as A. Plicae-circulars, B. haustra, C. rugae, D. villae. The answer is A. Plicae-circulars. 5. The outer muscle layer of the upper third of the esophagus mainly consists of A. Skeletal muscle, B. Smooth muscle, C. Both skeletal, D. Smooth muscle. The answer is A. Skeletal muscle. 6. Which structure helps attach the small intestine to the back wall of the abdomen? A. Greater omentum, B. Lesser omentum, C. serosa, D. mesentery proper. The answer is D. mesentery proper. 7. Which part of the gastrointestinal tract has the highest concentration of Peyer's patches? A. Stomach, B. Duodenum, C. Jejunum, D. Ileum. The answer is D. Ileum. 8. Histamine 2 receptor blockers. A. They compete with histamine to attach to the binding sites on parietal cells. B. They permanently attach to H+/K+ ADPase. C. They lower the acidity in the stomach. D. They help reduce allergy symptoms caused by histamine release. The answer is A. They compete with histamine to attach to the binding sites on parietal cells. 9. Proton pump inhibitors can lead to the following conditions. A. Development of gastric ulcers, B. Gastroesophageal reflux disease, GERD. C. Achlorhydria. D. Diverticulosis. The answer is C. Achlorhydria. 10. A patient who cannot handle oral medications might be given one of the following proton pump inhibitors to be delivered intravenously. A. Lansoprazole. B. Omeprazole. C. Pantoprazole. D. Esomeprazole. The answer is C. Pantoprazole. 11. When giving sucralfate to a patient who has a nasogastric tube, it's essential to A. Crush the tablet into a fine powder and mix it with water. B. Give it alongside a bolus tube feeding. C. Let the tablet dissolve in water prior to administration. D. Use it with an antacid to enhance its effectiveness. The answer is C. Let the tablet dissolve in water prior to administration. 12. Sucralfate works therapeutically by A. Balancing gastric acid levels. B. Improving the absorption of substances in the stomach. C. Creating a protective layer over the stomach lining. D. Reducing the production of gastric acid. The answer is C. Creating a protective layer over the stomach lining. 13. To prevent fecal impaction, how many ounces of fluid should psyllium be taken with? A. 2 ounce. B. 5 ounce. C. 8 ounce. D. 12 ounce. The answer is C. 8 ounce. 14. Loperamide can cause a bunch of side effects, but which one of these isn't one of them? A. Diarrhea. B. Epigastric pain. C. Dry mouth. D. Anorexia. The answer is A. Diarrhea. 15. Diphenoxylate works in the following ways. A. It boosts the amount of water excreted by the intestines. B. It ramps up intestinal movement. C. It slows down the contractions in the intestinal wall. D. It reduces how much water is reabsorbed in the bowel. The answer is C. It slows down the contractions in the intestinal wall. 16. A patient with a peptic ulcer is set to undergo a vagotomy. Curious about what this procedure is for, the patient asks the nurse. The nurse explains that the procedure A. Lowers food absorption in the stomach. B. Promotes healing of the gastric lining. C. Stops stress responses. D. Lessens the triggers for acid production. The answer is D. Lessens the triggers for acid production. 17. What task should be part of the immediate care for a patient who just had gastric resection? A. Keeping an eye on gastric pH to spot any issues. B. Checking for bowel sounds. C. Offering nutritional support. D. Watching for signs of bleeding. The answer is D. Watching for signs of bleeding. 18. If there's a perforation from gastric acid, which of these actions shouldn't be part of the immediate care for the patient? A. Blood replacement. B. Antacid administration. C. Nasogastric tube suction. D. Fluid and electrolyte replacement. The answer is B. Antacid administration. 19. Mucosal barrier fortifiers are utilized in managing peptic ulcer disease for which of these reasons? A. To reduce mucus production. B. To counteract acid production. C. To boost mucus production. D. To encourage hydrogen ion movement back into the mucosa. The answer is C. To boost mucus production. 20. When advising a client on how to avoid cholecystitis, which guideline should be prioritized? A. Follow a low-protein diet. B. Stick to a low-fat, low-cholesterol diet. C. Restrict exercise to just 10 minutes a day. D. Maintain a healthy weight for their height. The answer is D. Maintain a healthy weight for their height. Thanks for watching. For more, subscribe at Healthcare Insights.